Okay, so welcome to the interview. Today I'm joined by Patsy Wolber, Chief Operations Officer of Center for Physical Therapy and Education, or and Exercise. Um, so starting off the interview, um, how has the COVID-19 pandemic affected your business?
Well, in a lot of ways, Kyle. So, first, our patients that we serve, I'm sorry, I get choked up about it, but haven't been able to come into the clinic to receive their physical and occupational therapy services that they require to help them feel better and get better and, have a healthy life. So, that's first. Our mission of the company is to help people resolve their issues that they have. And because of this, we haven't been able to serve them for a variety of reasons. They either are a high risk population and they need to stay home.
Hmm.
They've been sick, which is sadder, and or they've been exposed. So it's hard to do that. Um, and then the second thing is our employees and staff. We're a team, we're a family, and
Hmm.
sorry.
It's okay.
And it's hard to have them work in this challenging situation and make sure that they're at the lowest risk possible, one,
Hmm.
and two, to continue to provide them with a sense of stability and security for their jobs. So that's a real challenge. Everybody's anticipating a layoff. We've had to lay off some folks, so it's or reduce hours, and it's a struggle and a challenge to maintain the business aspect of it and then the human aspect of it.
Sure, sure.
And then the future, the future is so uncertain, and so that's challenging to be able to plan for.
Yeah.
And we're used to being in the area for 30 years. We've supported the community for 30 years, and now it's hard to even plan and go forward with what the future is going to bring in light of this situation. But we're positively working to realize what we know, what we don't know, and factor those factors in. So that's all a challenge.
Absolutely. So I'd like to know um, what methods have you been using recently to restore customer confidence in your business?
So we send out letters to our patient population. We send email communication. We've phoned all of our customers, all of our patients, all of our referring providers, doctors and nurse practitioners and such, to say that, we have a low risk environment. We follow all the CDC and the state requirements for cleaning, disinfecting, social distancing,
Hmm.
screening of everybody, employees. We monitor our employees' health. We monitor our patients' health when they come in to if they're sick, to go home, call their physician, let us know if you need any help. We try to be supportive in that way. But so we've had web posts, Facebook posts on our website, just informing them of the actions that we've taken and what we're doing, and that our patients and our employee health and safety is foremost in our minds. So while we continue to serve them as best we can. So
Excellent. Um, I'd also like to know, is there anything you're experiencing at your business that the news isn't currently covering?
So I have to be 100% honest. I don't really watch the news. I find out my information online. I cannot, for my own well-being, listen to the news
Yeah,
a lot.
especially now.
So I do follow it very closely. I monitor the CDC sites, the state sites. You know, I'll read information in the news. So I don't really know everything that the news is doing. I just trying to stay focused on all the facts and how it impacts my business and the health of the community and our families and things like that. So I can't really say other than the fact that they have in general described the struggles of small businesses and things like that I know of. And there's a lot of healthcare providers, physicians, nurse practitioners, physical therapists in the day-to-day medical community not dealing with the COVID crisis. There's a huge impact. And I just am trying to stay positive that all those resources will be available when this returns, and that people can have been able to maintain their practice at some level to continue to serve the other needs, the health needs of the community, because it's so focused right now, and as it should be. But there are people out there struggling with other issues. You know, we get calls, oh, people are at home, they sprained their ankle because they're running more or exercising more, and you know, they don't know what to do. They don't want to go to the hospital. They don't want to go to their doctor. We're like, we're here for you. We'll talk to you over the phone. We'll do a telehealth visit. We'll help you out. But it's just those little day-to-day things that are not, you know, I'm not sure is being covered so well. You know, again, I don't watch the news that much. A little bit in the morning, I limit myself to a little bit. The governor's, you know, talks, I read the transcripts of those, that sort of thing. So
Like you just mentioned telehealth. Have you
yeah.
been using any other like digital methods of reaching out to your clients and helping them?
Well, we are bound by HIPAA laws, Health Information Privacy Act. It has been relaxed, I should say, during the COVID crisis. So, but we, you know, we reach out just through, like I told you, letters, emails to our patients, and phone calls, and now we have telehealth, a HIPAA compliant telehealth platform that we use to meet with our patients and discuss their progress or issues they're having, and provide their physical therapy through telehealth.
Excellent. So finally, just to wrap up here, what message would you like to convey to your customers, your employees, and the local businesses in your community as we all struggle during this turbulent time?
Well, you know, the major thing I think that we, and that I do see on TV all the time, you know, we're all in this together. We all have to do, face this reality together. But, you know, that the health and safety of the community and our fellow practitioners and people, everyone is at the forefront of our practice, you know, and that we express our deep gratitude to our healthcare colleagues that are on the front line, having to be exposed repeatedly with, you know, maybe not the best equipment and the best protective gear. I know in New Hampshire, we're fortunate right now in that we have the supply that we need. Whether that maintains the same, but even my employees that we deal with, you know, the elder population in some assisted living communities, we have to have PPE, and it's a struggle to get it. So protective equipment, so the masks and things like that. So I just want to express our gratitude and that we're here to help any way we can.
That's awesome. That's awesome.
I can't believe I'm so.
This is great. This is great. Real emotion.
Mhm.
Well, Patsy, I appreciate you taking time out of your schedule to be here today with
Right.
me and interviewing.
Yeah, you're welcome,
I know
Kyle.
it's especially a tough time for people like you in your industry right now. So I really do appreciate you being here and interviewing with me.
Well, and we really want to thank the community. You know, we've been in business for 30 years, served the community for 30 years. We're looking forward to another many years serving the community and want to work with our fellow healthcare providers to continue to do that and keep people as healthy as we can as we face crises like this, So I thank you for your time, Kyle, and good luck to you. Stay healthy.
Thank you. I'll try. You stay healthy as well.
Thank you. I will. Thank
All right.
you.
Bye, Patsy.
Bye-bye.